Ang dami-dami ng products and procedures na nakikita natin sa social media, and we don't even know which one is correct or not, or what to use and what to do.
Mag-guide tayo nito kung anong ba yung pinaka-okay na approach.
Yes.
Medical or surgical management for hair loss.
Good day everyone! Welcome to our 7th vlog at Hairtransplantph, where we try to share with you facts about hair loss and its medical and surgical management.
Again, if you, a family member or a friend is suffering from hair loss, or if you just have great interest in this topic, just click and like the subscribe button below. So, Dr. Jean, maganda
Yes.
na naman ang topic natin sa araw na ito at ito ay tungkol sa medical or surgical management for hair loss.
Uy, maganda yan! Kasi di ba nowadays, ang dami-dami ng products and procedures na nakikita natin sa social media, sa internet, and we don't even know which one is correct or not, or what to use and what to do.
Okay, so mag-guide tayo nito kung anong ba yung pinaka-okay na approach.
Yes.
We want to let the audience know that for this episode, ang pag-uusapan namin is more of tungkol sa androgenetic alopecia or yung hair loss because of aging. Kasi yun naman talaga yung pinaka-common na na-experience ng mga pasyente. Tapos, so ganito ang gagawin natin, no? Para mas clear sa audience, we will first try to give the general rules when to use medical management for hair loss. Then we will enumerate the general rules when to use surgical management for hair loss or hair transplant. And then after the general rules is given, we could probably give some sample photos and then mag-comment tayong dalawa. Okay ba yon?
Yes, sure.
Para makapakita sa inyo kung paano kami more or less nagmamanage ng mga patients namin na may androgenetic alopecia type of hair loss.
Okay, so let's start first with the medical management of hair loss. So first of all, medical management should be started at the first sign of hair loss. It is more effective if there would be hair. At any age to, either young or adult, pwede na tayong mag-start.
Tama yon, I agree with you, Dr. Jean. Kasi pagka sobrang thin na ng hair strand or worse, balat na talaga, hindi na talaga mag-work any amount of medicine na gusto nyo ilagay sa anit nyo
No more
or
effect.
any tableta na gusto nyong inumin. Okay?
So dapat may hair pa.
Exactly.
Okay, the second thing to remember is that these medications should be continued for life. So may forever.
Yun lang.
Oo.
For
So,
life talaga siya.
Yeah, for life. Because once you stop it, babalik at babalik yung hair loss mo.
Parang isipin mo nag-maintenance ka lang din sa face, di ba? May day, may night, forever and ever.
So parang rejuvenating set mo for your hair.
Correct.
So whether it would be a topical solution, an oral medication, or even the light therapies, dapat
Injectables.
yes, continuously dapat ginagamit
For life.
for life. So number 3, if in special cases, kapag yung patient is a poor surgical candidate, so ibig sabihin, hindi na kayang gawin ng surgical treatment,
Or may contraindications sa health niya.
yes, so we highly suggest that the patient should use medical treatment. So number 4, if ever the patient naman is a good candidate for surgical management, we also recommend them to use adjunct therapies like combination treatments. So both surgical and medical management din.
So may cases na
Yes.
pwede ring mag-medication kahit nagpa-surgery.
So this is to have a maximal effect of the procedure and the oral medications.
So let's go now to the surgical management naman for hair loss. So the first indication is, sinabi ko na actually kanina, Dr. Jean, Pag yung hair diameter nga is sobrang nipis na, or worse, skin na talaga, yung nandito sa taas, wala na. Ang next step na talaga is surgical management na ng hair loss or hair transplant. So second indication for surgical management is that the patient is not amenable naman to a medical management.
Baliktad naman.
Oo, may ganun ba?
I think, yes, of course.
Yes, marami kasing pasyente, marami kaming nami-meet, ayaw nilang mag-maintain forever. Tinatamad sila. Basically, yun yung pinaka-main reason nila. Ayaw nila magpahid everyday or ayaw nilang uminom everyday.
So they go for surgical treatment.
So the third indication is, kung other than aesthetic procedure ang gusto ng patient, meron din kasi kaming set of patients na nagpapa-hair transplant for scars. So trauma or post-surgery. So pagka ganon, surgical management of hair loss na agad yun. Let's go to the second part of this vlog, which is magpakita tayo ng konting pictures and mag-comment tayo, tingnan natin kung paano natin siya i-manage. Okay sa'yo yun,
Yes,
Dr. G?
sure.
So, kailangan mo umurong dito sa side ko kasi dyan lalabas yung photos natin. So, yan ang ating first picture.
Okay, first picture.
Oo. So, anong grade ba ito, Dr. G?
So actually, in genetic hair loss, meron kaming grading. So tinatawag namin yung Norwood classification. So for him, he's Norwood 3. So I presume bata pa yan.
Para sa kaalaman ng ating guest, bakit Norwood 3 itong nasa picture
Okay,
natin?
sige. To answer your question, Dr. Kakas, Norwood 3 is the classification wherein yung frontal area medyo umaatras na. So, minsan,
Sa
di ba?
gilid, sa
Yes, sa
gilid.
gilid. So, parang nagkaka-Batman style na siya ng hair loss. Pero, usually, yun yung pa-start pa lang ng hair loss.
He's young.
Oh, he's young. Hindi pa siya prepared for a surgical treatment. Pwede tayong mag-start ng medical management. So, usually, what we give are topical solutions like minoxidil. So, every day, every single day, he needs to apply that. And if he is willing to take the medication, the oral medication, so we
Pwede rin
give him
naman.
finasteride.
So, for this young patient na bibigyan natin ng medication, ang purpose natin is para hindi na umatras pa yung hair, no? So, yun basically. Halimbawa, late 20s or 30s na yung patient natin, paano kung Dr. Jean gusto niya pala magka-hair talaga itong area na to? Pwede
So,
bang kaya na ba yun ng medication?
Well, yun na nga, di ba sinabi natin kanina, if it's already skin na lang, hindi na kayang patubuin yon. So, kunyari, yung pasyente, nagto-topical minoxidil na, isasuggest na natin the surgical management would be
Correct.
hair transplant na
siya.
Yeah.
Oo. So, ito nang next case natin, Dr. Jean.
Okay.
Anong grade? Grade muna.
Ako, okay. Ito, kawawa naman, iwanan na. So, this grade, it's classified as Norwood 6 already.
Okay.
So, ano ba yung Norwood 6?
Norwood
Pag
6?
sinabi nating Norwood 6, frontal, and it goes back to the crown area.
Yun na
So,
yung degree ng hair
yes.
loss.
So, bald na siya hanggang crown. Minsan may makikita kang
Wala nang
maliliit
natira.
na hairs. Oo, pero majority, puro skin na.
Pero may hair pa siya dito sa gilid, no?
Yes.
At saka dito sa likod. Tama.
yes, correct.
Yan yung shaggy na tinatawag nila. Shagilid. Paanong management natin para kay patient na yan, na grade 6?
Sige, so for the grade 6, idiretso na natin.
Wala na, wala
Yeah,
na
we
ng
will
choice.
offer him surgical management. So, which
na.
is the hair transplant already.
Provided, dapat maganda rin yung
Yung
kanyang donor
donor.
area.
Yes, correct.
Oo. So, pero may value pa ba ang medical management for this case?
Yes.
Actually, meron pa. Pero it's more for to preserve yung level, yung height ng hair sa gilid. Kasi eventually, bumababa rin siyang ganyan. So, yun yung goal natin. Ma-preserve na mataas yung hair niya dito sa lateral areas and the occipital areas. Let's move on to our third case.
Okay.
Ano masasabi mo
so,
naman dyan,
this one
Dr.
naman, androgenetic alopecia pero in females.
Female naman ito, yes.
So, for the classification, we have the Ludwig's classification. So, ano to? Class 2.
Mga grade 2. Okay. So for Ludwig 2, ang nangyayari is nakikita nyo na mas obvious na yung part sa gitna, no? So nakikita nyo na yung scalp nyo, it's showing through, and numinipis na rin yung hair strands. Kaya nag-show na talaga yung scalp.
So, ang gagawin natin would be, first, i-offer natin yung medical treatment, which is topical solutions only. So, hindi pwede sa kanila ang oral finasteride.
Yun na ba? Matatapos na ba tayo sa medical management?
No, not yet. So, aside from medical management, we can offer also surgical management. So,
Yes.
actually, 2 options yan. Meron kaming ginagawa na scalp micropigmentation. So, we have patients na girls na ayaw magpa-opera, natatakot magpa-opera. So, we offer them scalp micropigmentation. So, these are parang micro tattoos that we put on the scalp. Yeah, micropigments, very, very tiny. And then, to cover the skin.
Yes.
So, pero, ang problem naman,
Camouflage.
yes, camouflage, yung density is manipis pa din.
So kung ayaw naman nila nung tattoo, gusto nila ng real hair, edi hair transplant na tayo, no? So combination therapy, medical and surgical hair transplant. Kasi makaka-increase yun sa density nung hair netong patient na to.
Okay, so that ends our episode for today.
I hope you learned a few facts on the difference between medical, surgical management, or using both to help you with your hair loss problems. And we hope to see you in our next episode.
Until next time, okay,
Bye.
bye!